Breast cancer screening is a crucial part of detecting the disease early, but there is a change coming to the guidelines about when women need to get them. Our medical expert, Dr. Payal Kohli, is here to break that down for us. Thanks for coming in.
Good morning.
So tell us about the new guidelines. It sounds like not everyone is on board with the changes.
We definitely are not. In fact, this has created a lot of confusion and a lot of doubt in the medical community. So the old guidelines, the American College of Radiology said as soon as you turn 40, if you're an average risk woman, you need a mammogram every single year, even after the age of 75, if you're a young 75. The new guidelines actually emphasize less screening, less often. So they say between 40 to 50, you can talk to your doctor if it even makes sense to start. Between 50 and 74, you get a mammogram, but now every 2 years instead of every year. And then after 74, well, you can talk about whether it makes sense to stop because you might not live that much longer.
I like when you asked, or you said that not all experts agree with this. You answered by saying, yes, we don't. So you put yourself right in that group. I'll ask you then, doctor, why the change? Why did the change happen?
Yeah, so they're basically, the American College of Physicians came out with these guidelines. This is in contrast to the American College of Radiology. So the ACP is saying we're screening too much. We're testing too much. We're getting too many false positives, and we're having too many biopsies in women. The ACR, the American College of Radiology, is pushing back and saying, especially in young women, knowing that breast cancer is the most common cancer in women, 1 out of 8 lifetime risk. We're seeing it now in younger women. We actually save lives by screening women starting in their 40s. So that's kind of the push and pull. Are we over testing? Are we not testing enough? But I think it leaves a lot of women and physicians a little bit confused about what to do. Now, I'm certainly in the camp of the ACR where more testing has been shown to have a benefit. The ACP is going off of old data with respect to mortality.
I mean, you just brought it up. I mean, this is confusing. It's confusing for women out there. It's like, well, now I don't know when to go.
Yeah.
What can they do? Like, what should they do?
So the first thing to do is any woman at 25 needs to calculate her lifetime risk. Okay, and sometimes your doctor won't always do this, your OBGYN won't always do this. So you do this yourself. You go to an online calculator, you put in all your risk factors, you know, your first period, when it started, your family history, if you've had chest radiation, all of those types of things. If you've already had a child, you can put that in. Calculate your lifetime risk. If you're high risk, you need to start early, like probably in your 20s. If you're average risk, then you sit down and talk to your doctor. Again, for me, it's a personal decision. We maybe have to personalize screening for every woman, but if I had a choice, I would say start screening at 40, because screening at 40 and doing it every year has been shown to save lives.
Can you answer this about a mammogram? I'm sure there's certain things when you get those results back that women should look out for. What are certain things on that mammogram results that people should really be keyed in on?
So you know what a lot of women do? They just look at that section on the bottom that says no cancer, and you're good. You need to read the entire report because there's 3 key findings you have to get out of your mammogram. So first, of course, cancer or not, right? And then that determines when your next mammogram or if you need a biopsy or anything. Second, breast density. So half of women have dense breasts, and dense breasts hide cancers, and they also are higher risk for cancers because there's more breast tissue. So if you have dense breasts, then you may actually need an MRI, or you may actually need a special type of mammogram called a 3D tomosynthesis mammogram. And third, as a cardiologist, I always look at this too, it's something called breast arterial calcifications. So these are the tiny little blood vessels in the breast. If they can start getting plugged up with calcium deposits, plaque, or cholesterol, that predicts a heart attack or stroke or risk of dying 20, 30 years later, because you're going to plug up the big blood vessels. So in your 40s and 50s, if you start having BACs, breast arterial calcifications, which they don't always call out at the bottom, then you actually need to see a cardiologist and get some more aggressive risk reduction.
It's really good information, Dr. Kohli. Thank you so much for coming in.